up, y'all?
Oh, I feel like a traitor. Welcome back to a couple of MPs.
I am your host, Loic Asamo.
I am Patience. Oh, you said your whole last name.
Oh, I'm sorry. They like family already.
Right.
They know us.
Y'all show y'all family. Anyway, welcome back, guys. We apologize for how negligent we have been in putting out episodes.
Negligent.
Loic, do not start.
The people gotta know.
Loic.
The people gotta know who's fault.
Wow. You remember, I still haven't said I do.
But you will.
Okay, whatever. Yes, guys, but majority of that has been my fault. I have been so lazy between work, summer things. I was being a hot girl with all my friends.
Well, okay. It's a little bit of both our fault, but we're back with more content for you guys.
Yes.
And we know it's been the summer, so a lot of you new grads may have just been taking your finals and your boards. And right now you're working on certification, but in the back of your mind, you're always thinking about how are you going to secure a job.
Right, dang, Loic, you just jumped right into it. I thought you were still apologizing.
Come on, let's go.
Okay, so yes, Loic hit it right on the nail. So today we are focusing on how to prepare for your job interview.
How to secure the bag. Right.
All right. Like Loic just said, most of you guys probably graduated in like May or June. You spent your summer studying. You passed your boards, or if you haven't passed your boards, do not give up.
Yep.
Keep trying.
Keep going.
Right?
Keep going.
That certification, you're gonna get it. Just keep trying. And if you have already passed your boards, the next thing you're looking at is securing a job, right? You're probably choosing which state you want to be certified or licensed in. And if you already decided that, now you're looking at where to apply.
Right.
Our number one advice is apply.
Apply to all of them.
Apply to every and anything that interests you, okay?
Even if it's just to get that experience for the interview.
Right.
Apply.
Sometimes they may say, hey, we're looking for somebody with 2 years of experience. Apply, okay? Because sometimes they may say that, but when desperation calls, hey, your little 1 year as an RN, if you're becoming an MP right now, or your years as a CNA, or
those are all healthcare experiences that may be relevant.
Yep, they're gonna count. So just apply. The most they can tell you is no. Right. So that's the first advice. The second advice is get your resume in order.
Right. You gotta make sure all your certifications are updated on your resume. So if you're CPR certified, if you got this certification, you apply that to your resume.
Right.
Make sure all your jobs. I know a lot of us have been working as RNs for a while and we haven't kept up with that resume. But,
or LPNs or CNAs.
Yep. So make sure you update all the relevant experiences, especially as it relates to this job that you're applying to.
Right. And make sure that you name every skill that you needed for that job, so that way they can see your experience as well, right?
And some skills are also like, if you're bilingual, si tu parles français, for example, you can add that to your resume because it may be relevant to that population. That practice may see a lot of patients that happen to speak French also, and they may see it as an asset to have a provider that speaks that language as well.
Right.
So.
Yeah, that was a good one. Look at you, right?
I tried.
Right? Make sure that your address is updated. Make sure that your email address is updated, because that's your primary means of being contacted. So you want to make sure that they're able to get in contact with you when they're ready to. Okay?
Right.
This third thing, I think we're on the third point, right? I can't even keep up. The third thing is, the biggest question that they're going to ask you guys is, what can you bring to the practice? And this is where your research comes in. Before going on that job interview, look up this practice, look up their providers, look up their goals, what they're working towards. Sorry, guys. And like,
look up the community that it's in.
Exactly.
Because you got to understand the type of patients that they'll be seeing. Try to understand the type of challenges that these patients might have going to a practice like this, so that you will be prepared to explain to this practice what you bring to the table, how you can help them improve the quality of the care that they give to that community.
Right. So you can put yourself right in the center of that, to let them know that you are able and you are willing to bring this and that to the practice. I always like to say being a new grad to some of these practices are such an advantage, right? You bring so much new knowledge that, you know, the evidence-based knowledge that you bring to the table is so important and it's so updated that, you know, they can use it. A lot of the times we who haven't been in school for a while are still doing things that we've learned when we were in school, right? But sometimes new research is out. Don't play with me like that. New research is out. We try to stay up to date, but they like to hear that.
I keep it up to date.
I keep updated too, but sometimes, listen, I was that student where with my preceptor, I would tell them like, hey, this is what we're doing now. And they'll be like, oh, you know, I didn't know that. So I'm pretty sure there are a lot of things that we don't know is new, but we try to practice as up to standard as we can.
Yeah.
Right?
Another thing about a new grad, you might feel that it's your lack of experience is something holding you back, but sometimes that can be a luxury. Us who have been working in the field for a while, sometimes we get used to how we do things, and so it's hard to adapt to a new circumstance. And so let the practice know you're fresh out of school, but you're willing to adapt to however way they do their thing at that practice.
Oh my God, what's our favorite phrase? You can be molded into a provider that fits the practice. Yes. Oh my God, y'all better use that. Say that just like that. You can be molded. That's how I'm saying it right? I feel like I'm not saying it right.
In addition to saying, don't just say this stuff. You got to be open-minded, right?
Yeah.
You got to be willing to get into something and learn how they do things and adapt to it.
Right, absolutely. And then last but not least, they are going to ask you, do you have any questions for them, right? I know sometimes you are probably so nervous and anxious. You're probably like, oh, no, I'm good. Thank you so much. It was such a pleasure. I mean, you know,
it's like,
if that's you, do that.
But yeah, you gotta you show interest, right?
You gotta show interest.
When you ask questions, you let them know that you're interested.
Right. And we like to say that going for a job interview is like going on a date, your first date, right? Yeah. Right? You want to know everything about them just like they want to know about you.
Do you want to know everything about them?
Bye, Loic. Bye. They're asking you all these questions about what you can bring to the table. So this is your chance to to ask them what can they bring to your table. Okay.
Also, don't be surprised if they ask you how much you expect to make in this job.
Right. Yeah, that's always an uncomfortable question.
Right. The bag is usually the part that everybody's scared to talk about.
Which is why you got to do your research as to what LPN, RN, CNA, or MP, what they make in your specialty in that area.
Exactly.
So that way you can have a comparative value to give to them. Otherwise, you are left hanging by your drawers and you're throwing out numbers and that number may scare them to be like, oh, I ain't calling her back. Or you can
She just got us. Who she thinks she gonna be? Nah.
Or you can undersell yourself.
Right.
You might end up getting paid like maybe 10, 15K less than what you deserve. And honey, no.
They will get away with that if they can.
Absolutely will, right? So please do your research on, And I will always like to say also, think about your benefits package. Ask them what kind of benefits they offer.
We will do future episodes about these things. When you get your first job, you got to talk about your benefits.
Right.
You got to talk about your vacation.
Right.
Is it PTO or is it actual earned or vacation that you accrued?
Accrued.
You got to talk about your 401k, guys.
Yeah, I promise I got a master's degree. I promise.
We got to talk about 401k. It's very important when you're working your real job, your real career. You got to have some type of plan for when you're going to retire. And you got to talk about bonus. How does that work?
Absolutely.
Are you on salary or are you on RVU? These are all the things that you have to understand before you go in for that.
Salary versus RVU is most in reference to MPs.
Yes, exactly.
But also about your CEUs, right? Your continuing education.
Do they fund that?
Right?
Or
do they fund that or do you have to fund that? Because you do need these to renew your license, right? So you want to make sure that there is room for you to do continuing education, and that I always ask for, the way I put that in is professional advancement. Right? What are some opportunities for professional advancement?
And even to add to that, if you're a new grad, you may also want to know if you have a go-to person, whether it's a mentor or just somebody in the office that's dedicated for you to help in your development.
Right. And I know we already said last but not least, but this is definitely last but not least. Always ask about your onboarding time, meaning how long is going to be your orientation, and do not sell yourself short, right? Because most of these places, because they're in high demand and such urgency to get you up on the floor and running, that they might say 3 weeks. 3 weeks may not be enough for you in that situation, right? Or in that setting. So advocate for yourself to say, hey, maybe say okay to the 3 weeks, but if that 3 weeks is up and you're not prepared, by all means, tell somebody.
Right. And your orientation, you got to make sure that includes learning the electronic medical record system, learning the different processes in the office, and also your workflow, meaning how many patients you're seeing. And sometimes it may be smart if during that orientation they have you see a small amount of patients and build up slowly. And this may be the time that you need a mentor the most, right? Because this is the first time you're doing a lot of these things, so you want to have a go-to person.
Right. Don't sell yourself short. Sometimes you may be that stellar student that, grasps onto everything and you're ready to go off on your own in about a month, whereas normal orientation is probably 2 to 3 months, right? Just because they see how well equipped you are, do not let that pressure put you into a predicament where you're off on your own and you did not get the full time that you deserve, okay? Make sure you get all of your experience so that way, God forbid anything happens, you have a backup, to say, hey, I went through this. I have this training, as opposed to somebody saying, yes, she never even finished or he never even finished his orientation.
Right.
Right?
Yeah.
That makes sense?
No, that makes sense.
Okay. Yeah. So, yeah. Did we do it?
I think we did it.
We did it. Ooh. Okay, y'all. So thank you for tuning in.
Thank you so much for tuning in. Please don't give up on us. Yes. We haven't quit. Please.
Make sure to like, comment, and subscribe.
Yes, share, please.
Yes,
share. Give us your comments on things that you want us to talk about.
Yes, it will be better.
Right.
Bye, guys.